ਫੰਡਾਂ ਤੋਂ ਸਖਣੇ ਚਾਈਲਡ ਵੈਲਫੇਅਰ ਸਿਸਟਮ ਕਾਰਨ ਪਰੇਸ਼ਾਨ ਫਸਟ ਨੇਸ਼ਨਸ ਚਿਲਡਰਨ ਤੇ ਉਹਨਾਂ ਦੇ ਪਰਿਵਾਰਾਂ ਨੂੰ ਮੁਆਵਜ਼ਾ ਦੇਣ ਲਈ ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ $40 ਬਿਲੀਅਨ ਜਾਰੀ ਕੀਤੇ ਜਾਣਗੇ। ਕੈਨੇਡਾ ਦੇ ਇਤਿਹਾਸ ਦੇ ਸਭ ਤੋਂ ਲੰਬੇ ਕਲਾਸ ਐਕਸ਼ਨ ਲੋ ਸੂਟ ਦੇ ਫੈਸਲੇ ਅਨੁਸਾਰ ਓਟਵਾ ਨੂੰ $20 ਬਿਲੀਅਨ ਰਿਜ਼ਰਵ ਅਤੇ ਯੂਕੇਨ ਦੇ ਉਹਨਾਂ ਬੱਚਿਆਂ ਨੂੰ ਦੇਣੇ ਹੋਵੇਗਾ ਜਿਨ੍ਹਾਂ ਨੂੰ 1 ਅਪ੍ਰੈਲ 1991 ਤੇ 31 ਮਾਰਚ 2022 ਦਰਮਿਆਨ ਅੰਜ਼ਾਈ ਆਪਣੇ ਘਰਾਂ ਤੋਂ ਪਾਸੇ ਕਰ ਦਿੱਤਾ ਗਿਆ ਸੀ।
So turning now to today's announcement, I'm very pleased to announce that Canada and the parties have reached two significant agreements in principle. One that provides fair and equitable compensation to First Nations children and families harmed by discriminatory underfunding, and the other addressing the long-term reform that's needed for the First Nations Child and Family Services Program. I want to thank the parties that have worked all so hard and together. As I mentioned earlier, the Assembly of First Nations Child and Family Caring Society, Chiefs of Ontario, Anishinaabe Nation, and Mushoom Trout, as well as our own teams at Indigenous Services Canada and Justice Canada for staying at the table and working through these important and historic negotiations.
This historic settlement of $40 billion has been a long time coming. First Nations from across Canada have had to work very hard for this day to provide redress for monumental wrongs against First Nation children, wrongs fueled by an inherently biased system. The Assembly of First Nations has been pressing this issue for more than 30 years, including strong advocacy by First Nations, rights holders, and families. Persistence of the Assembly of First Nations in human rights proceedings, in the courts, and now at the negotiation table. A human rights complaint launched in 2007 and our win at the Canadian Human Rights Tribunal, and every effort to forge a path to end discrimination against First Nation children and families in the federal child welfare program to ensure that it never happens again. Discriminatory funding under the federal First Nations Child and Family Services programs and other decisions has led to a massive overrepresentation of First Nations children into the child welfare system in every province and territory in this country. Every day for decades, First Nations children, some even newborns, have been ripped from their families and communities, and many denied medical services and other supports when they've needed them. All at the hands of a federal child welfare program that should have protected them. More than 200,000 children and families are impacted by this compensation agreement. This wasn't and isn't about parenting, it's in fact about poverty. And First Nations children being removed from their families and communities instead of being provided help with food, clothing, or shelter. The federal child welfare program was broken from the start. Most Canadians do not know this, that there was actually an incentive for child welfare agencies to remove children. In fact, a First Nations child welfare agency would not receive funding unless the child was removed from their home and placed into foster care. And until recently, the federal government's narrow implementation of Jordan's principle resulted in First Nations children being denied medical and other services, in some cases forced parents to place their children into care.
ਟੋਰਾਂਟੋ ਦੇ ਅਧਿਕਾਰੀਆਂ ਅਨੁਸਾਰ ਓਮਿਕਰੋਨ ਦੇ ਮਾਮਲੇ ਅਜੇ 4 ਤੋਂ 6 ਹਫ਼ਤਿਆਂ ਤੱਕ ਆਪਣੇ ਸਿਖਰ ਉੱਤੇ ਪੁੱਜਣ ਦਾ ਖਦਸ਼ਾ ਹੈ, ਪਰ ਅਧਿਕਾਰੀਆਂ ਨੂੰ ਡਰ ਹੈ ਕਿ ਇਸ ਦਰਮਿਆਨ ਸਟਾਫ ਦੀ ਘਾਟ ਦਾ ਉਹਨਾਂ ਨੂੰ ਸਾਹਮਣਾ ਕਰਨਾ ਪੈ ਸਕਦਾ ਹੈ। ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਤੇ ਚੀਫ ਮੈਡੀਕਲ ਆਫੀਸਰ ਡਾਕਟਰ ਐਲਿਨ ਡੀ ਵਿਲਾ ਵੱਲੋਂ ਮੰਗਲਵਾਰ ਨੂੰ ਸਾਲ 2022 ਦੀ ਪਹਿਲੀ ਕੋਵਿਡ-19 ਅਪਡੇਟ ਦਿੱਤੀ ਗਈ। ਉਹਨਾਂ ਚੇਤਾਵਨੀ ਦਿੱਤੀ ਕਿ ਸਾਨੂੰ ਇਸ ਵੇਰੀਐਂਟ ਤੋਂ ਇਸ ਲਈ ਵੀ ਸੰਭਲਣ ਦੀ ਲੋੜ ਹੈ ਕਿਉਂਕਿ ਇਹ ਤੇਜ਼ੀ ਨਾਲ ਫੈਲਦਾ ਹੈ। ਡੀ ਵਿਲਾ ਨੇ ਆਖਿਆ ਕਿ ਘੱਟੋ ਘੱਟ 4 ਹਫ਼ਤਿਆਂ ਤੱਕ ਇਸ ਦੇ ਸਿਖਰ ਉੱਤੇ ਪਹੁੰਚਣ ਦੀ ਸੰਭਾਵਨਾ ਹੈ ਤੇ ਇਸ ਦਾ ਅਸਰ ਸਿਟੀ ਦੀਆਂ ਕੁਝ ਸੇਵਾਵਾਂ ਉੱਤੇ ਜ਼ਰੂਰ ਪਵੇਗਾ।
I know there's a lot of uncertainty, a lot of anxiety in the minds of people. I know many people, especially our frontline healthcare workers, are absolutely exhausted. And I know that there is a real fear of the unknown shared by many people as we face this Omicron variant. I understand that. I have been trying, as many of you have, to provide reassurance to my family to the extent that I can, and I know many of you are trying to do the same thing. As mayor, I want to help as many people as possible, together with the other members of our team, to get through this as well as we can. Beyond the overall management of the pandemic, along with the rest of the city's team, I will be making it a top priority to continue to offer reliable, consistent communication to Torontonians over the coming weeks so that they can be as informed as possible. Today, I want to detail how we are working to deal with a much wider impact from the virus and the variant on the City of Toronto, and I'll be joined, of course, by my two colleagues in laying that out for you. This is a different variant, and so we have to adjust in order to combat it. But I know that this city, the people of Toronto, and your city government will be able to make this transition and confront this new challenge. By working together within the city government, with the other governments, with our healthcare and community partners, and with the people of Toronto, we have done relatively well over the last 22 months. I know there's been a lot of pain and frustration, but we've done relatively well. And now it is up to all of us to make the transition to this new reality quickly and effectively, which I know that we can and we will do. We've made it this far thanks to consistent cooperation, and I am committed to continuing that cooperation over the coming weeks. I remain as committed as ever to working with the City Council, with the GTHA, Greater Toronto Area mayors and chairs, and with the other governments to wrestle this pandemic to the ground. And I know that Premier Ford and Prime Minister Trudeau share that commitment.
COVID-19 is hitting closer to home than ever before, with many of our friends and acquaintances, colleagues and co-workers becoming sick with COVID-19 or isolating because they are a high-risk contact of someone who has COVID-19. We might even get COVID-19 ourselves, and with such a highly contagious variant, we must take the slightest symptoms seriously and isolate right away to help protect others. For those of you who remain well, if you can help someone who has fallen ill by dropping off food or just calling in to just check up on them, please do so. The Omicron variant is now, as expected, widely circulating in Toronto. While early data suggests that Omicron results in less severe disease, we are seeing its capacity to give rise to a high number of cases. And even though only a small percentage of those cases have severe disease, we are already seeing an impact on our healthcare system through increased hospitalizations for COVID.
ਅਲਬਰਟਾ ਦੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਮੰਗਲਵਾਰ ਨੂੰ ਇੱਕ ਕੋਵਿਡ-19 ਅਪਡੇਟ ਦੌਰਾਨ ਕਿਹਾ ਕਿ ਉਹਨਾਂ ਦੀ ਸਰਕਾਰ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਫੈਲਣ ਦੀ ਨਿਗਰਾਨੀ ਕਰਨਾ ਜਾਰੀ ਰੱਖ ਰਹੀ ਹੈ, ਪਰ ਵਾਧੂ ਸਿਹਤ ਪਾਬੰਦੀਆਂ ਇੱਕ ਆਖਰੀ ਅਤੇ ਸੀਮਤ ਉਪਾਅ ਹਨ। ਇਸ ਦੌਰਾਨ ਅਲਬਰਟਾ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਫਸਰ ਡਾਕਟਰ ਡੀਨਾ ਹਿੰਸ਼ਾ ਨੇ ਦੱਸਿਆ ਕਿ ਮੌਜੂਦਾ ਸਮੇਂ ਸੂਬੇ ਅੰਦਰ 34,000 ਕੋਵਿਡ-19 ਦੇ ਸਰਗਰਮ ਕੇਸ ਹਨ।
First, I want to wish all Albertans a happy new year. 2022 may not be starting out as we had hoped for or envisioned, but despite our ongoing challenges with COVID, we do have good reasons to be thankful and optimistic about the year ahead, especially as Alberta continues to lead Canada in economic growth, and we see lots of good news on the jobs front and economic diversification. But just as we wrapped up the holidays, I want to recognize Alberta's fantastic healthcare workers, the first responders and frontline workers who continue to give up time with their families to care for Albertans. We see the sacrifices that you are making, and everyone is truly grateful for your dedication, especially those of you who worked over the holidays and put in extra shifts. I also want to recognize the many Albertans who made the effort to limit their New Year's celebrations over the holidays, over the past weekend in particular. I know that none of us wanted to be ushering in a new year by having to postpone, cancel, or limit much anticipated gatherings with friends and family members. I know it's been disappointing, but the actions that we take now are critical to protect our healthcare system from the impact of this highly transmissible Omicron variant of COVID-19. While Omicron is less severe at an individual level, even a small percentage of a very large number of people requiring hospital care can put our healthcare system under real pressure. Today, we are reporting more than 30,000 active cases, but that's defined as people who have tested positive on a PCR test. But we know that the number is actually much higher with a positivity rate of 30%. And that's why we do expect to see hospitalizations rise in the weeks ahead. It's also why Alberta Health and AHS is doing everything they can to prepare our health system for the impact of this wave. I'm calling on the Government of Canada to help us out with that by taking immediate action to authorize the use of Pfizer's COVID antiviral pill, Paxlovid, that was recently approved for emergency use in both Europe and the United States and other jurisdictions. We need to use every tool at our disposal, and this can be a helpful tool for our physicians and frontline staff. This drug can be used for the treatment of mild to moderate COVID-19 in anyone that's 12 years of age and over who is at a high risk for progression to serious situations like hospitalization. The approval and subsequent procurement of this drug could help to save lives. Now, before Christmas, we announced additional public health measures to better protect our province, and this included reducing capacity by 50% for venues participating in the restriction exemption program that seat more than 1,000 people. It also included setting limits to those seated at a table, no mingling between tables, no interactive activities like dancing or billiards at hospitality businesses. And last week, we responded to the concerns of school boards and extended the holiday break for students from K to 12 until January the 10th.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਸੂਬਾਈ ਸਿਹਤ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਬੌਨੀ ਹੈਨਰੀ ਅਤੇ ਸਿਹਤ ਮੰਤਰੀ ਨੇ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਪ੍ਰਤੀ ਸੂਬੇ ਦੀ ਪ੍ਰਤੀਕਿਰਿਆ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਡਾਕਟਰ ਬੌਨੀ ਹੈਨਰੀ ਨੇ ਦੱਸਿਆ ਕਿ ਸੂਬੇ ਅੰਦਰ 80% ਕੇਸ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਹੀ ਸਾਹਮਣੇ ਆ ਰਹੇ ਹਨ। ਇਸ ਦੌਰਾਨ ਸਿਹਤ ਮੰਤਰੀ ਨੇ ਪ੍ਰਾਂਤ ਦੇ ਅੰਦਰ ਚੱਲ ਰਹੀ ਵੈਕਸੀਨ ਬੂਸਟਰ ਮੁਹਿੰਮ ਬਾਰੇ ਚਰਚਾ ਕੀਤੀ।
As you know, the virus has changed and is spreading rapidly. The Omicron strain that has now taken over here in British Columbia means that we are in a different race, in a different storm now. The Omicron variant of concern has taken over the Delta variant and is now the cause of over 80% of the new cases that we're seeing across British Columbia. It varies slightly in the north where it's not quite that high yet, but the data that's posted on the BC CDC website makes it very clear that this has been a variant that has been dramatically different and is spreading in a different way. And those pieces of the puzzle that I talked about a number of weeks ago are starting to come together. It also means that we need to respond slightly differently to this new strain that we're seeing. While we are seeing the rates of hospitalizations and those in critical care slowly creeping up, it's no longer the case that we have 3 or 4 degrees of separation, that you know somebody who knows somebody maybe that might have contracted the virus. The rate of transmission that we're seeing now in British Columbia, like many other jurisdictions around the world, means that at this point, most people in BC likely have a friend or a family member or a colleague who has been infected with the Omicron variant. Right now, in the tug of war of transmission, Omicron has the advantage, and we see that in the rapidly increasing case numbers we're seeing here and that we're seeing around the world. For now, in British Columbia, we have taken measures to try and slow that down, and we are coping. But everything we do now makes a difference. Everything we've done up until now has also made a difference. Our efforts have mattered. So many people in BC are vaccinated, are getting our booster shots, and using those many layers of protection from keeping distances, wearing masks, staying home if we're feeling unwell. This is the right thing to do, and this is what will get us through this phase as well. It means a lot of people will get sick, and we are seeing that now. But your vaccine will protect most people from serious illnesses and from hospitalizations.
With respect to the accelerated booster campaign, I just want to remind everyone that 4,399,771 British Columbians have received their first dose immunization from COVID-19, 4,136,540 their second dose. And as of last night, 961,014 have received their third or booster dose. That's in the over 12 population, 92% of all those over 12 received their first dose, 89% their second dose, 21% their third dose.
ਮੈਨੀਟੋਬਾ ਦੇ ਪ੍ਰੀਮੀਅਰ ਹੀਥਨ ਸਟੀਫਨਸਨ ਨੇ ਵਿਨੀਪੈਗ ਵਿੱਚ ਇੱਕ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕੀਤੀ ਜਿੱਥੇ ਉਹਨਾਂ ਸਕੂਲ ਵਿੱਚ ਵਿਦਿਆਰਥੀਆਂ ਦੀ ਵਾਪਸੀ ਲਈ ਸੂਬੇ ਦੀ ਯੋਜਨਾ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। ਉਹਨਾਂ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ 10 ਜਨਵਰੀ ਤੋਂ ਇੱਕ ਹਫ਼ਤੇ ਲਈ ਸੂਬੇ ਅੰਦਰ ਵਿਦਿਆਰਥੀ ਰਿਮੋਟ ਲਰਨਿੰਗ ਦੇ ਮਾਧਿਅਮ ਨਾਲ ਆਪਣੀ ਪੜ੍ਹਾਈ ਜਾਰੀ ਰੱਖਣਗੇ।
As we continue to deal with the challenges of COVID-19 and learn more about the impacts of the Omicron variant, I want to thank the healthcare workers across our province who have worked tirelessly to provide quality care throughout this pandemic. Thank you for your dedication and commitment to your patients and their families, especially during these difficult times. Our government's #1 priority is to protect the health and well-being of all Manitobans, especially our most vulnerable. And this is what brings us here today. As previously announced, students were set to return to the classroom on January 10th, following an extended winter break. Today, we are announcing a 1-week remote learning period beyond January 10th to help ensure schools can implement enhanced measures for the safe return of in-person learning. We know that our youth learn best in a classroom setting. It is our goal to ensure they can return to the classroom as quickly as possible.
On December 22nd, our government made the announcement to extend winter break until January 10th. Today, we are announcing a phased-in approach for return to school in January and are shifting to a 1-week remote learning period for most students after the holiday break. This phased-in approach will allow school divisions and schools to have more time to prepare operational plans, including planning for potential staffing shortages and expected absenteeism due to isolation requirements. Discussions with Manitoba Education's response planning team have reinforced the importance of this extra time to plan for a return to class as soon as possible. This planning team has been in place since March of 2020, and it includes the Manitoba Association of School Superintendents, the Manitoba School Board Association, the Manitoba Association of School Board Officials, the Manitoba Teachers Society, Manitoba Federation of Independent Schools, and public health officials. This will ensure public health officials have more time to assess the effects of the Omicron variant. Effective January 10th, this phased-in approach will allow students of critical service workers in kindergarten to grade 6 and at-risk students and students with special learning needs in kindergarten to grade 12 to attend school. Before and after childcare programs will remain open for students of critical service workers and students with special needs who are attending school this week. All other students will learn remotely until they return on January 17th.